My name is Chris Williams with Emeritus Health, home of Balance University. This is our medical director here at Emeritus Health, Jill Anderson. And so we're lucky to have her with us. And it's really a unique story how you and I got hooked up. I started working on Balance University actually as a fluke. I was looking for a balance program to take a course. I wanted to take a course and become certified in some kind of balance course so that I could implement it into work with some of my clients and what you would call patients.
Right.
Well, what I quickly found was I was going to have to implement some of my knowledge no matter what we did, because a lot of the balance programs had extremely high entry points, like trying to get people to stand on one foot for 15 seconds. How many patients do you have right now that you think could stand on one foot that are 65 and older for 15 seconds?
Very few. There's few people that are in their 30s that could probably stand on one foot for 15 seconds. So when you consider the older adult population, that's probably extremely low.
Break it down in percentages. Is it 50? Is it 40?
Probably 20% if we're lucky. And those are the very active people that are runners, or they're extremely active in their everyday lives and have extremely good core and balance, but that's going to be a very small percentage over 65.
So here's what happened is I asked Jill if she would help me with the program, coming up with different exercises and taking a look at it and see what she could shoot holes in. I wanted her to make it better. I wanted her to tell me I was wrong about something so I could make it better. And it's interesting because she went to work and she started doing some research on different programs, and I think that well, you tell us, what drew you to Balance University?
Well, again, you're looking for something that we want to be preventative. In healthcare now, we're really looking and moving towards being as preventative as we possibly can be, whether it's disease prevention or fall prevention or anything along those lines. So what we're looking for is something that's going to be easy to do, but it's also going to help you prevent injury or illness or whatever else futuristically. So that's what drew me to you to say, okay, what kind of a program is available out there that's going to allow people to maintain or improve their balance over a period of time, but something that's really easy, that kind of gradually and really steps you through one by one as to how to get to your core and improve your balance.
And you saw the same thing that I saw, right? A lot in your research?
Yeah, I went through, I did actually quite a bit of research, and there are some programs that are already established that are out there. However, they don't have the same kind of step therapy that we see in Balance University. It's more of a social experiment and trying to get people to have social interaction and so forth through some type of exercise activity. But what we're looking at is, as the social aspect is extremely important, we also want to focus on prevention. And that's where the Balance University comes in, because we're looking to prevent falls. Falls are an extremely dangerous thing as we get older, and we've got to do what we can do to prevent falls in older adults so that they don't suffer injuries that can be fatal to them if we don't take care of them. Absolutely.
Right. You know, I think one of the biggest, the happiest days in my Balance University life was we had met and we were talking and discussing about a certain program that implemented a social aspect. And when you talk social aspect, what that means is that camaraderie. It means getting around friends and being around other people, because as we get older, we get less mobile. We tend to go out less. We tend to do other activities.
Right.
And a lot of it is because we don't want to fall in front of people. We get embarrassed. And so what Balance University is based on is facts. It's actual data and science that is going to improve your balance, not I feel like I'm better balanced. And I think that's one of the biggest things that you brought to me in your research. You came to me and said, oh my gosh, I can't believe this. This is what I found. So
yeah, and that's really what our goal is. You know, I've been working in tandem with Chris for almost a year now. We've really been working on this to try to see how effective we can be in improving people's balance, but being very realistic about it and not having unrealistic expectations of people over a period of time. And that's why it is a 10-week program. But if you go from start to finish, we've had a lot of people already say that they have had tremendous improvement in their balance, and has given them confidence to be more active in social environments and so forth. So that's been a great thing.
So if you or someone you love, someone you know that's struggling with their balance, please check us out at mybalanceuniversity.com. You can find us on Facebook at Emeritus Health. You can even find us on Twitter, and a great resource is at YouTube. If you just go in and type in Emeritus Health, there's over 80 videos. Probably one of the biggest balance libraries, video libraries you're going to find in the country on YouTube. So check us out. All right, Jill. Thank you very much.
Thank you. Thanks,
All right.
Chris.